201. The use of alcohol-based hand sanitizers is effective for removing all pathogens, including norovirus. True or false? Answer: false. Rationale: alcohol-based hand sanitizers are not effective against certain pathogens like norovirus, which requires proper hand washing with soap and water. 202. Disinfection is the process of killing or inactivating nearly all microorganisms, including bacterial spores. True or false? Answer: false. Rationale: disinfection kills most microorganisms but does not eliminate bacterial spores. Sterilization is required to kill spores. 203. Patients with infections that are transmitted via contact precautions should be placed in a private room. True or false? Answer: true. Rationale: private rooms are recommended for patients with infections transmitted via contact precautions to reduce the risk of transmission. 204. The transmission of infections through the air is prevented by wearing surgical masks. True or false? Answer: false. Rationale: surgical masks are not sufficient to prevent airborne infections. N95 respirators are needed for airborne precautions. 205. It is important to follow the manufacturer's instructions when cleaning and disinfecting patient care equipment. True or false? Answer: true. Rationale: following the manufacturer's instructions ensures that equipment is disinfected properly and prevents cross-contamination. 206. Infected healthcare workers can transmit infections to patients and should report symptoms immediately. True or false? Answer: true. Rationale: healthcare workers with infections can transmit pathogens to patients, so it is essential to report symptoms to prevent further spread. 207. Hand hygiene should be performed before touching a clean surface and after touching a contaminated surface. True or false? Answer: true. Rationale: hand hygiene helps prevent cross-contamination by ensuring hands are clean before touching clean surfaces and after touching contaminated ones. 208. Gowns should be worn during all patient care, regardless of infection status. True or false? Answer: false. Rationale: gowns are only required for patients who have a known or suspected infection that could be transmitted through direct contact or bodily fluids. 209. The use of disposable equipment reduces the risk of infection transmission in healthcare settings. True or false? Answer: true. Rationale: disposable equipment helps minimize the risk of cross-contamination between patients and environments. 210. Vaccination of healthcare workers is an essential component of infection control practices. True or false? Answer: true. Rationale: vaccination helps prevent healthcare workers from contracting and spreading infectious diseases in healthcare settings. 211. The flu vaccine is only recommended for healthcare workers who work directly with patients. True or false? Answer: false. Rationale: the flu vaccine is recommended for all healthcare workers, as they may still come into contact with infected individuals, even indirectly. 212. Healthcare workers should change gloves between tasks to prevent contamination. True or false? Answer: true. Rationale: changing gloves between tasks helps prevent the transfer of pathogens from one patient or area to another. 213. If a surface appears clean, it does not need to be disinfected. True or false? Answer: false. Rationale: surfaces that appear clean may still be contaminated with pathogens and need to be properly disinfected. 214. Properly maintaining ventilation systems can help reduce the spread of airborne infections in healthcare facilities. True or false? Answer: true. Rationale: proper ventilation reduces the concentration of airborne pathogens and helps prevent the spread of infections. 215. Patients in the same room with an infected individual should wear masks to reduce the risk of infection. True or false? Answer: true. Rationale: wearing masks reduces the risk of droplet transmission between patients and healthcare workers in shared spaces. 216. Is acceptable to reuse face shields as long as they are cleaned between uses. True or false? Answer: true. Rationale: face shields can be reused as long as they are cleaned and disinfected properly after each use to prevent cross-contamination. 217. If a healthcare worker is in direct contact with a patient's blood or bodily fluids, they must wear gloves and a gown. True or false? Answer: true. Rationale: gloves and gowns protect healthcare workers from exposure to infectious blood or bodily fluids. 218. Infected surfaces should be wiped with a clean, dry cloth to remove pathogens. True or false? Answer: false. Rationale: surfaces should be cleaned with a disinfectant, not just a dry cloth, to effectively kill pathogens and prevent infection spread. 219. Infection control procedures should be followed more strictly when caring for patients with compromised immune systems. True or false? Answer: true. Rationale: patients with compromised immune systems are more vulnerable to infections, so infection control procedures must be followed rigorously. 220. Healthcare workers should dispose of contaminated PPE immediately after use to prevent transmission of infectious agents. True or false? Answer: true. Rationale: contaminated PPE should be disposed of immediately to prevent the spread of infectious agents to other patients or environments. 221. Alcohol-based hand sanitizers are effective in killing Clostridium difficile spores. True or false? Answer: false. Rationale: alcohol-based hand sanitizers are not effective against Clostridium difficile spores, which require washing with soap and water. 222. A healthcare worker who has been exposed to a bloodborne pathogen should undergo post-exposure prophylaxis (PEP) treatment. True or false? Answer: true. Rationale: post-exposure prophylaxis (PEP) is recommended for healthcare workers who have been exposed to bloodborne pathogens to prevent infection. 223. Protective isolation is used for patients with a weakened immune system to prevent exposure to pathogens. True or false? Answer: true. Rationale: protective isolation, or reverse isolation, is used to protect immunocompromised patients from infections that they could acquire from their surroundings. 224. Universal precautions are only necessary when caring for patients with known infectious diseases. True or false? Answer: false. Rationale: universal precautions should be used with all patients, regardless of their known infection status, to prevent the spread of infection. 225. Isolation precautions should be discontinued as soon as a patient's symptoms improve. True or false? Answer: false. Rationale: isolation precautions should not be discontinued until the patient is no longer contagious, even if symptoms improve. 226. N95 respirators should be worn when caring for patients with tuberculosis. True or false? Answer: true. Rationale: N95 respirators are required for airborne precautions when caring for patients with tuberculosis, as it is transmitted through the air. 227. A patient with a methicillin-resistant Staphylococcus aureus (MRSA) infection should be placed in a private room. True or false? Answer: true. Rationale: MRSA is spread through direct contact, and placing the patient in a private room reduces the risk of transmission. 228. The risk of infection transmission is reduced when healthcare workers clean their hands after patient contact. True or false? Answer: true. Rationale: proper hand hygiene after patient contact reduces the risk of transmission of pathogens to other patients and healthcare workers. 229. When a patient is placed under airborne precautions, they should be placed in a room with negative pressure. True or false? Answer: true. Rationale: negative pressure rooms help prevent the spread of airborne pathogens, as air is drawn into the room and filtered before being released. 230. Gloves should be worn when handling patient care items such as linens, even if the linens appear clean. True or false? Answer: true. Rationale: gloves should be worn when handling any patient care items, including linens, to prevent cross-contamination, even if they appear clean. 231. The use of personal protective equipment, PPE, is essential for preventing healthcare-associated infections, HAIs. True or false? Answer: true. Rationale: PPE, including gloves, gowns, masks, and face shields, is essential in preventing healthcare-associated infections, HAIs, by protecting both healthcare workers and patients. 232. Surgical masks are adequate for preventing the transmission of tuberculosis in healthcare settings. True or false? Answer: false. Rationale: tuberculosis requires airborne precautions, including the use of N95 respirators, not surgical masks, to protect against transmission. 233. Isolation precautions for a patient with a viral infection should follow the same guidelines as for a bacterial infection. True or false? Answer: false. Rationale: isolation precautions may vary depending on the type of infection, viral or bacterial, as different pathogens require different approaches to prevent transmission. 234. It is acceptable to wear the same pair of gloves for multiple tasks on the same patient, as long as they are not visibly soiled. True or false? Answer: false. Rationale: gloves should be changed between tasks to prevent cross-contamination, even if they are not visibly soiled. 235. Clean hands should be dried with paper towels after washing. True or false? Answer: true. Rationale: paper towels are recommended for drying hands after washing to prevent recontamination with bacteria from cloth towels. 236. Contaminated or soiled linen should be placed directly on the floor before being placed in a laundry bag. True or false? Answer: false. Rationale: contaminated linen should not touch the floor, as this can lead to further contamination. It should be placed in a laundry bag directly. 237. It is essential for healthcare workers to follow standard precautions, such as wearing gloves, even when caring for patients with no known infections. True or false? Answer: true. Rationale: standard precautions, including wearing gloves, should be followed for all patients to reduce the risk of transmission of unknown infections. 238. The use of antibiotics in infection control practices can contribute to the development of antibiotic-resistant organisms. True or false? Answer: true. Rationale: the overuse and misuse of antibiotics can lead to the development of antibiotic-resistant organisms, making infections harder to treat. 239. A mask should be worn during procedures that involve the potential for splashing or spraying of blood or body fluids. True or false? Answer: true. Rationale: masks are necessary to protect healthcare workers from exposure to blood or body fluids during procedures that may cause splashing or spraying. 240. Infection control measures for patients with multi-drug-resistant organisms, MDROs, are generally less stringent than for patients with other types of infections. True or false? Answer: false. Rationale: infection control measures for MDROs are more stringent to prevent the spread of resistant pathogens, often requiring isolation and contact precautions. 241. A face shield is required when performing procedures that have the potential for blood or body fluid splashes. True or false? Answer: true. Rationale: a face shield is required to protect the mucous membranes of the face during procedures that could cause blood or body fluid splashes, ensuring proper infection control. 242. Hand washing with soap and water should always be performed after touching contaminated surfaces. True or false? Answer: true. Rationale: washing hands with soap and water is essential after contact with contaminated surfaces to remove any pathogens and prevent the spread of infection. 243. A surgical mask is effective in preventing the spread of airborne diseases like tuberculosis. True or false? Answer: false. Rationale: a surgical mask is not effective for preventing the spread of airborne diseases like tuberculosis. An N95 respirator is required for such diseases. 244. Droplet precautions are needed for patients with diseases like influenza. True or false? Answer: true. Rationale: influenza is transmitted through respiratory droplets, so droplet precautions, such as wearing a mask, are required for patients with this infection. 245. A healthcare worker should wear gloves when handling medication for a patient who has a known infectious disease. True or false? Answer: true. Rationale: gloves should be worn to prevent the transmission of infection when handling medications for patients with known infectious diseases. 246. It is safe to reuse personal protective equipment, PPE, if it is visibly clean. True or false? Answer: false. Rationale: PPE should not be reused as it may become contaminated during use, increasing the risk of infection transmission. New PPE should be used for each patient interaction. 247. A healthcare worker can wash their hands with alcohol-based hand sanitizers if the hands are visibly dirty. True or false? Answer: false. Rationale: alcohol-based hand sanitizers are not effective if hands are visibly dirty. Soap and water should be used in such cases to properly clean the hands. 248. Antibiotics should be prescribed to all patients with a fever to prevent infection spread. True or false? Answer: false. Rationale: antibiotics should not be prescribed for all patients with fever unless a bacterial infection is confirmed, as antibiotics are not effective for viral infections and can contribute to resistance. 249. Contact precautions are necessary for patients with wound infections that are draining. True or false? Answer: true. Rationale: wound infections with drainage can spread pathogens through contact, so contact precautions, including wearing gloves and gowns, are necessary to prevent transmission. 250. A patient with suspected viral meningitis should be placed on airborne precautions. True or false? Answer: false. Rationale: viral meningitis is not spread through airborne transmission. Standard precautions or droplet precautions, depending on the suspected virus, should be followed.